Hey everybody, I'm doing a webinar tomorrow night, and as I was preparing for this, I really captured this thought that is really important for dentists to understand. Because as we look into our practices, we look at the things that we want to change and what we want to get out of the practice. A lot of times we get lost in what are we doing right now? What do we need to improve or change? And what can we do to get more patients, get more income, all this sort of stuff. And so it turns into this kind of you're molding clay, like you're trying to mold your practice into something that you want to give to the patients. And when we start with that formula, it really gets difficult to see what we really need to do in order to gain more patients, in order to gain more acceptance. And I want to show you a slide here because I think it really embodies what it is that we're looking to do as we're trying to grow our practice. And let me show you here. All right. So, okay. So this is what we want. Well, let me go back. This is what we want, right? We want less stress, and I'm going to be talking all things about scheduling tomorrow, and that's kind of why this is more focused on scheduling. But we want less stress. We want to be better organized. We want the data flow. You want to go in and out of different operatories and be, guided by your assistants or hygienists to the next place, and you want it to be organized in such a way that there's no wasted time, right? You want patients to be running on time, right? And you want to see them return for their work. It's, when you do an exam with somebody and you feel like you've gained that trust, we sometimes get upset because it's just like, well, why didn't they schedule back? I mean, we spent all that time, right? You want to leave every day knowing that you're productive. How many times have you been in your office and you've worked all day and all of a sudden you get to the end of the day and you look at your production report and like, what was I doing all day? Like we did so much. How did it end like this? We were way off the mark, right? We want to see patients on time. We want to scale our practice without having to live there, right? And then, of course, last thing, we want to have confidence knowing that patients want what the work that we give them, right? Well, we have to back out of this mentality or else we're going to get trapped. You can't get better at giving people what they don't want. And if you're looking at this list going, I'm going to fine tune everything until I make it exactly the way that I want it for my patients, we're starting with the wrong mindset. We got to figure out, okay, well, what is it that patients want from us? All right. And if you think about our schedule, one of the things that patients want from us is convenient times for their appointments. Now, most of you are open between, Monday and Thursday, 8 to 5. And I know that's very common, but I want you to really think about that for a second because it's not very convenient for patients to take off of work or to get to your practice. If you do have any convenient times, it's going to be the early morning times or the late afternoon times. So for you guys, it's going to be between like 8 and maybe 9:30, maybe 10, all the way to 3 in the afternoon to 5 would be a peak demand time for you guys. Maybe an hour at lunch or something like that. But you're really positioning yourself so that you only have a little bit of time that a person can come to your practice without having to take off of work. All right. So in contrast to an office that's open, let's just say from 7 to 3, they've got at least a couple hours in the morning that it could be that if somebody come in without having to take off work, or maybe open on a Friday or a Saturday or something like that. And I know for some of you are like, oh my gosh, I would never want to work those days. And I get that, but we've got to think more like a consumer than we think like a dentist. All right. And so so follow me here for a minute. The patients also want a cleaning on the first visit. All right. And I know that I want to encourage you, go listen to the way that your front office is answering the phone. Like when you're not with patients, and I know that you're probably not sitting around your office all the time, but when you do have the time, go listen to the way they're answering the phones and how they answer this question here. And the way that they're getting the question, you'll hear something like, oh yeah, let's go ahead and get you scheduled. We may or may not be able to do the cleaning just depending on the time that we have, but we'll absolutely put it down and let them know that that's important to you. Or you're going to hear this, oh, I'm sorry, Mrs. Jones, we don't do cleanings on the first visit. If you hear that second thing, you need an overhaul. You need an overhaul in the way that you're talking to patients because they don't want to hear that. I understand the reasons why you say that, but what you're doing is you're putting up a wall. You're basically saying, don't come to our practice because we won't even try to give you a cleaning. All right. They want an easy experience. And that goes back to kind of that conversation about, okay, well, I want a cleaning, or, we need to be the ones that are guiding the experience, and we need to listen. Okay. Now, there's a burger place right next to my house. Okay. It drives me nuts. I like the burgers. My kids love it. It's a nice enough place. But I tell the people what I want before they ask me. I say, could I please have a Southwest burger combo with French fries and a Coke with that? And their next question is, would you like to make that a combo? I say, yes, I would like to make it a combo with French fries and a Coke with that. Okay, did you want fries with that? Yes, I want fries with that. Yes, I want a drink. Like, they keep on asking me the same questions, and we're doing that in our dental office. We're like, okay, all right, so you want a cleaning? All right, when do you want to come in? And they've already said that, hey, this is the time I'm available. Or, we don't capture their name in the beginning, and so we're like, okay, I'm sorry, how do you spell your first name? B-O-B. I mean, we're not listening. All right, so we've got to listen. We've got to make this an easy way for them to make appointments. Okay, not everybody can do it. I've been in hundreds of dental offices all over the nation, and there's so many well-meaning people that are working at the front desk, but when you're going to hire somebody at the front desk, you don't even need to see them. Like, you don't even need to have them in your practice until you're thinking to yourself, I would definitely hire this person based on their ability to be in conversation on the phone. Like, there's no other reason that you need a front desk person if they can't even answer the phone well. So if your phone conversation with them about, hey, I saw your resume and I'd love to invite you to the practice. I'd love to just get to know you a little bit better. If that's not like inspiring you on the phone, then don't waste your time. They're not going to, I mean, again, you definitely want to make sure that they don't have three eyes, or whatever, five heads or whatever. But the point is that they can't master a phone call for somebody else if they can't master a phone call with you in your first impression with them. Okay, people love options, but they don't want too many options. Like, when I tell people, hey, what's your best day and time that would work for you, they're looking at their calendar going, well, what would be the best day and time that would work for me? And then they say, well, actually, Friday at noon would be great. Oh, we're not open on Fridays. Oh, okay. All right. Well, I could come in on Saturday. Oh, I'm sorry, Mrs. Jones. We're not open on Saturday either. Oh, okay. Well, I could do 7 o'clock on Thursday. Oh, we're not open on. It's like, just give them some options. Okay. Pick two options. Even in an office that makes, that's Monday through Thursday, 8 to 5, you can give them options that will help them to have a good experience in your office, but it won't sabotage you having the same conversation about, oh no, we're not this or that or whatever. Okay, they want to be seen on time every time. Okay, I want to go back to the slide that is for you. Okay, you want to see them on time every time. There's a way to do this. Okay, and you should join my seminar because I'll tell you all about how to do this. It's not complicated. But when you give an experience to the patient that they're seen on time every time, this is not happening in other doctors' offices. And it's a tragedy because it could be. It really could be. It's not that complicated. All right. But I've seen doctors, dentists all over the nation fix this problem, and it has reduced the amount of stress that they carry out throughout the day. It reduces the amount of stress that the team carries throughout the day. It reduces the stress that the patient has sitting in the office waiting for their appointment, that sort of thing. They're seen on time every time. All right. This is totally possible. Come to the seminar, or text me, email me. I'll tell you all about it. But last thing is this, is they want to have confidence knowing that what they're getting is what they really need. Now, here's the thing. You can't give them that confidence if you can't do these other things. All right. You could be the best dentist in the world. You could be the most thorough and just likable, lovable dentist in all the world. But if you can't give patients these other things, the whole time they're going, nope, nope, nope. They're scratching it off their list. Like, well, first of all, it was hard to make an appointment. Second of all, they wouldn't even give me a cleaning because they said they don't do that on the first visit. They just overwhelmed me with too many options, or they didn't give me any options. It was just kind of, you have to come this day and time. I waited in the office for about 30 minutes for my appointment. And now they're telling me that I need 3 crowns on my right side, and then I need this deeper cleaning on my upper left. It doesn't even make sense to me. Okay. Inspiring your patients starts with making the appointment. It starts with just the first impression, just like it does with you, okay? Your first impression is so crucial, but we've got to get out of thinking like a dentist or thinking like a dental professional, and we've got to start thinking about what does the consumer want from me here? Because when you can do that, you can master this ability to gain acceptance from patients, and they'll overlook a whole lot of sins, all right? If you can do all the things that make it most convenient and desirable for them. So my name is John Ruddy. I'm That Dentist Guy. Go to thatdentistguy.com to find a little bit more about what we do. Go to thatdentist.com/appointment to make a 45-minute appointment. We can talk about your practice, how you can improve, what we can do to assist you with that. My upcoming webinar is coming up. It's actually tomorrow, and I'll put in the comments here how you can register for that link. But this is so crucial. You need to think like a consumer when it comes to dentistry, and that's how you build a booming practice. That's how you invite more and more people to your practice. That's how you leave at the end of the day going, you know what? I did my job. I'm so glad I did it. You guys have a great day, and we'll talk again soon.